New this morning, Kelly Osbourne says she will have her ovaries removed due to the same cancer gene that Angelina Jolie has. Valley doctors are weighing in on this health decision. Jolie revealed that she had her ovaries and fallopian tubes removed to prevent cancer.
She revealed the details in a New York Times op-ed. This just 2 years after the actress also underwent a double mastectomy to prevent breast cancer. Jolie says she is talking about this to empower other women to take control of their health. This morning, we are finding out if you should be concerned as well. Jackie Ochoa is live in Scottsdale with a doctor to help us answer some questions for you.
Hey, good morning there, Doug and Faye. Yes, this is the New York Times article that we are talking about here this morning that Angelina Jolie wrote about, where she talked about having her ovaries and her fallopian tubes removed to prevent ovarian cancer. Now, we are being joined by Dr. DeRosa here in Scottsdale. Now, Dr. DeRosa, the first thing I want to ask you is you have had patients who have undergone this. What does it take, and why have they made these decisions?
Well, when you're looking at an odds of 9 out of 10 chance that you're going to develop breast cancer, or a 50-50 shot of developing ovarian cancer, which can kill you, usually by the time we diagnose ovarian cancer, it's a very, very high risk. I personally would make that choice if I had the BRCA genetic testing. I think she had a very prudent choice, or she made a very prudent choice.
Okay, so people like Angelina Jolie can make decisions like this, and as we just heard, Kelly Osbourne, is this affordable for folks like you and I?
Well, certainly, first step is to get tested for the BRCA genetics, and that can run anywhere from about $3,000 to $3,000. But keep in mind, most testing, the basic testing, is about $300–400, and there's Care Credit, which is a credit card designed just specifically for medical care, and that's a 0% interest for 12 months. So if you can annualize that over the 12 months, that makes it much more affordable. It is your life you're talking about. Forgo that nail treatment that you're going to have that month and get tested.
Yeah, now you mentioned that nail treatment because we were just talking about kind of the cost. You compared it $60 to pay for your nails, $30 or $50 for some of the hormone treatment that you need afterwards.
Absolutely. But certainly if you have those genetic testing, undergoing the surgery is often covered by insurance if you demonstrate that you have that high risk. So the first step is identifying that you have the risk, so obtaining the BRCA genetic testing, and then meeting with the geneticist to sit down, if you do have it, to decide, is having this pretty radical surgery to remove both your breasts and your ovaries and fallopian tubes, and in most cases the uterus, which Angelina Jolie chose not to do, but to have that surgery is a very complex and radical choice, but a very good one made under the right circumstances.
All right, thank you, Dr. DeRosa, for all that insight. Now, of course, before we head it back to you guys in the studio, you know, if you are someone who is concerned at home, the best thing to do is just consult your doctor. Doug and Faye, we'll send it back to you guys in the studio.
Yeah, it's interesting because the price seems to have come down a little bit. I actually inquired about this a couple years ago, and it was I was quoted $5,000 back then. So it seems like hopefully the prices are coming down on the testing a little. All right, Jackie, thank you very much.